Hey guys, from our previous videos we talked about sciatica and how it can be an excruciating pain running down your leg. So what we're going to do today, before we show you how we treat sciatica, is go through the science and the anatomy of what's going on with your lumbar and your sacrum, your lumbar spine. So what we're going to do is we're going to bring it down to a small level, a joint, and typically the most common area where we see misaligned with patients in our office that do have sciatica is at the L5 S1 Junction. It's the last bone of your spine when it combines with what we call your tailbone or your sacrum. So when we look at a normal functioning joint, what you want to see is that you have an upper bone, a lower bone, and a disc in between. All right? These bones should be able to move forwards, backwards, side to side, and rotate without any type of pain, restriction, or any type of decreased motion. However, when we sit all day, when we start to have a weak core, what happens is these bones go from their normal position, they shift forward, they shift backwards, or they shift to the side, and they start to put stress not only on, the nerve, but all the muscles, ligaments, and tendons in the low back. When this happens every day, every week, every month, every year, over time our bodies can't handle this, and eventually our bodies start to give off pain, which is sciatica. So what we're going to do next is we're going to bring Suzanne in and we're going to find a subluxation around her L5 S1, and we're going to treat that by showing you how we do this in our office. Alright guys, so before we treat any of our patients for sciatica, the first thing we're always going to do is a detailed consultation, a motion palpation examination, and last but not least, our state-of-the-art motion study x-rays. This is going to allow us to treat the exact area, and it's going to allow us to know what specific bone we need to put back. So we've already done that with Suzanne. We've already checked all those boxes off. The first way we're going to treat sciatica is by opening up that joint space. This technique is called flexion distraction. We're going to touch the L5 S1 bone. We're going to distract it from each other. We're going to open up that disc space, and by doing that, we're going to allow beautiful fluid to pump back into the disc and allow it to heal properly. So what you're going to see here is Suzanne, her feet are going to be pressed down, and I'm going to contact the L5 S1 joint here with my palm. I'm going to hold it, push her feet down, and I'm going to distract that joint nice and easy. I'm going to raise her back up, do the same thing by holding that joint, pushing down, holding that joint. We're going to do this about 3 or 4 times until the doctor or the clinician can feel that joint open up and relax. When that joint opens up and relaxes, it's going to give some immediate relief to that patient, and by doing that, that's going to take care away some of that pain. The next technique which we are going to do is called a chiropractic adjustment. This is where we're going to adjust the bone and take the pressure off the nerve, which we talked about was called a subluxation. So what I'm going to have Suzanne do is completely lay on her right side. The specific term for this technique is side posture, and what I'm going to have Suzanne do is keep her right side of her body straight. I'm going to have her bring her left ankle behind her left knee. I'm going to cross over her arms here. I'm going to palpate. I'm going to find that S1 L5 bone that isn't moving with my fingers here. Once I find that, I'm going to contact it with the palm of my hands right here. I'm going to bring her towards the table. I'm going to lower my body down and push that bone right back into where it needs to be. Very simple, very light, low velocity technique. If you know anyone that might be suffering from sciatica and needs our help, please like, share, and subscribe to our page.